Okay, hello everyone. Thank you so much for joining us today for the Stanford Institute for Human-Centered Artificial Intelligence virtual community event with Karen Eggleston and Yong Lee. They will be discussing with you their paper, The Impact of Robots on Staffing in Nursing Homes. And if you would like to ask our speakers a question, please go to the HAI events website and click on the button that says Join the Conversation. And you can also find the link in the Zoom chat room. And let me just briefly introduce our two speakers today. So Karen Eggleston is a senior fellow and the director of the Stanford Asia Health Policy Program, and also deputy director of the Shorenstein Asia Pacific Research Center at the Freeman Spogli Institute for International Studies at Stanford. She is also a fellow with the Center for Innovation and Global Health at Stanford School of Medicine and a faculty research fellow at the National Bureau of Economic Research. Eggleston earned her PhD in public policy from Harvard and has a master's degree in economics and Asian studies from the University of Hawaii and a bachelor's degree in Asian studies from Dartmouth College. Eggleston's research focuses on government and market roles in the healthcare sector and Asia health policy, especially in China, India, Japan, and Korea, healthcare productivity, and the economics of the demographic transition. She served on the Strategic Technical Advisory Committee for the Asia Pacific Observatory on Health Systems and Policies, and has been a consultant to the World Bank, the Asian Development Bank, and the World Health Organization regarding health system reforms in China. Yong Lee is the SK Center Fellow at the Freeman Spogli Institute for International Studies and the Deputy Director of the Korea Program at the Walter H. Shorenstein Asia Pacific Research Center here at Stanford University. He received his PhD in economics from Brown University, a Master of Public Policy from Duke University, and bachelor's and master's degrees in architecture from Seoul National University. These main fields of research are in labor economics, technology and entrepreneurship, and urban economics. Some of the issues that he studied include technology and labor markets, entrepreneurship and economic growth, along with education and inequality. His current research focuses on how the new wave of digital technologies, such as robotics and artificial intelligence, affect labor, education, entrepreneurship, and productivity. And thank you so much, Karen and Yong, for joining us today. My understanding is that Karen will present the first half and Yong for the second half. Remember to everyone, if you have questions for our speakers, please go to the HAI events website and click on the button that says join the conversation. You can also find the link in the Zoom chat room. Thank you for joining us and to our terrific speakers. So Karen, why don't you take it away?
Thank you very much, Mark, and thank you all for joining us today and for your interest in this research. We look forward to your questions and comments. It's preliminary work and incomplete, but we look forward to discussing this line of research with you. This is joint research with our colleague from the University of Tokyo, Toshi Iizuka. We know that the impact of robots likely differs by labor market conditions and service and industry. So in one of the first studies of the service sector, using establishment level data, we examined the impact of robot adoption on staffing in nursing homes. So we all know, and if you're tuning in today, probably your work or your interests are related to the new wave of technologies, AI and robotics. But of course, these technologies inspire fear in many countries, and many jobs are projected to be replaced by these technologies even before the current economic downturn and its implications. Yet, these new technologies may remedy some social problems or challenges associated with various social problems such as population aging. And they could, in the midst of a pandemic like now, assist in certain ways. So one of the questions that we're looking at in this line of research is, are the effects of robots different in labor markets characterized by aging and declining working age population as you have in Japan, which is our context. In the context of pandemic, you all may be aware, you've seen the pictures, the robots in healthcare in Italy or in long-term care in parts of Asia. In the future, will such robots help to avoid the devastating pandemic spread and the institutionalized oldest old, enable humane care and social connection, despite the pure act need for physical distancing from loved ones? We don't really know, although that might be the potential of these technologies in the future. This line of research is related to that. Our current data can't really answer that question. We want to look into that. So what we do, we ask how adoption of robots affects workers and productivity in nursing homes in Japan. Although what I'll be showing here, our current preliminary work doesn't really drill down into productivity yet, although we've collected new data that we hope to look into that. So specifically, we examine the impact of robots on the staffing, the number of care workers and nurses, regular, irregular, the turnover of those workers, and on their wages. And here we see our contribution, particularly to provide evidence on robots based on establishment level data rather than aggregate data that has been used, and in the service sector rather than in industry and manufacturing, and in a particularly stark case of population aging, where the effect of robots may be different in many dimensions. So our research goals more broadly in this line of research are to understand about the adoption of robotics in long-term care and other service sectors, impacts of productivity and quality of care, although that is difficult to measure and doesn't have as robust a literature in the context of Japan that we're studying, but ultimately we want to contribute to that. So some of the related questions are, how does adoption of robots affect labor inputs in nursing homes, workers with different tasks? How does the adoption of robots affect the quality of care ultimately? And are there complementarities between robots and different types of labor? So we think that Japan is a good case study because of its high level and rate of population aging. Indeed, it's pioneering the world of the future in terms of older population age structure. It also has a relative caregiver shortage and a low reliance on immigrant labor, although it's beginning to relax some of those restrictions and open up in light of the need for additional labor. So what are some of the possible impacts of robots on the labor market? There is a detailed literature. Many of you may have contributed to that. I won't go into great detail. We're trying to be in dialogue with this literature where broadly you can think of different kinds of effects that have been found in different studies in different settings. One, of course, is finding displacement and possible de-skilling of labor, such as in industry or in the US in famous studies, and other aspects of automation. This may not be as much the case when there's a tight labor market and may be concentrated on certain types of labor. Other studies have found the possibility of augmentation and upskilling, sometimes for same kind of workers or different tasks that the workers undertake. Yong can talk about some as related study on that later if you're interested. But in particular, in the nursing home or long-term care service context, you may think that robots have the potential to augment the current care workers, reduce their physical burden, and reduce their turnover rates, therefore, and possibly increase their wages and lead to upskilling if they're helping with burdensome tasks, and so on. So ultimately, the effects of robots is an empirical question and may depend on the context. So the overview of what we study here, looking at the early phase of technology diffusion in the labor market, we'll focus mostly about 2017 data from Japan, where there's a high demand but low supply of care workers. So our hypothesis is that automation through robotics in nursing homes is unlikely to completely replace labor, but may augment caregivers and potentially increase quality of care. We still have to collect data to look at those longer dimensions. What we do is document the correlates of robot adoption with the recent cross-sectional data and study the effects of robot adoption on staffing, wages, turnover, and wage share. And how do we claim to study impact, not just correlation? As we'll explain in a minute, we use an instrumental variable approach to try to study causal effects. So we used prefecture level subsidies for robots and used plan number of robots subsidized per nursing homes as our IB to look at robot adoption facility level. So I will preview first talking about Japan's robot strategy overall. Japan has been a leader in terms of robot production and in utilization. This is partly related to its demography, as noted. The share of the population over 65 is expected to reach 40% in the coming decades, which is really unprecedented in the history of the world. Well, many of us will be following that in many. US, you may know, it's only 17, 18% now, quite different. Now, Japan is also actively developing and deploying robots specifically designed for nursing homes, as in many places in Europe and here. But specific focus on that in Japan, both on the development side and also on the subsidy side. So why is that? There's a growing demand for long-term care given its population structure. This shows you in maps the proportion of the population age 70 and over, and then the proportion of nursing home residents with the highest functional limitations, care levels 4 and 5. And you can see the geographic distribution there. Overall growing demand and limited supply of care workers also lead to tight labor markets, which I'll show you in a moment. But this variation across prefectures is important because we're going to draw upon that in related to the subsidizing of care robots. So on the supply side, as we mentioned, this ministry, MEDI, has identified tasks and technology areas where they subsidize development of long-term care robots. And then they all, on the, you might say, the demand side, they're also subsidizing nursing homes to purchase and use robots. So, and we'll talk a minute about the unique data set that we've collected that documents this across prefectures and over time. But you can see that this is fairly widespread by the most recent time period, and Yong will be talking about that. So let me also briefly introduce the setting of long-term care in Japan. Japan adopted universal long-term care insurance in the year 2000. This covers elderly above the age of 65. It has 5 care required levels that we use in talking about controlling for case mix at the facility level. It's relatively comprehensive and includes day care. In other words, the elderly will be at home and then they're taken for care during the day, like children are taken to a daycare center. There's also in-home services. What we focus is on residential nursing homes where people go there and stay for a while, either permanently until end of life or to rehabilitate after a certain episode needing care. And important to note that the government regulates the service prices and its uniform benefits across the whole country, as in its healthcare system, also in its long-term care insurance system. So we focus on residential nursing homes, 3 types: the standard sort of nursing home providing long-term care services and supports, or you might call custodial care, comes in smaller and larger sizes. And then a rehabilitation kind of care, something similar to skilled nursing facilities. We control for the differences and look at the differences there. So what do we find? I'll just give you a preview of what we're looking at here. First, defining robots. There's a specific definition that's used nationally and in the data collection in Japan. So robots have ability to sense information, make decisions based on that, and take visible action. So we can define that kind, distinguish it from other technologies that we observe in nursing homes. And specifically, long-term care robot is used by the caregiver or the frail elderly person, him or herself, to reduce burden or help with users. So there are various kinds of long-term care robots. We found in our time period that in 2016, around 18% of nursing homes are reported using any type of robot. That went up to around 26% by the 2017 period that we'll be showing you. Many of those are monitoring robots that help to prevent falls and getting out of bed at night, et cetera, and alert the caregivers to that. Some are transfer aid, wearable by the caregiver or by the frail to elderly person themselves, and some other types. So you might be curious what that looks like. I'll just show you some of those. Here are transfer aid. The wearable kind senses and gives support to the muscles to the caregiver. We know that turnover is often related to complaints of back pain among caregivers, particularly what we'll be calling care workers, which are giving physical contact care to the residents of the nursing homes. There are also transfer aids that are non-wearable, shown here, that assist, transferring from the bed to a wheelchair and so on. There are also monitoring systems, as I mentioned, the most common type, which has many functions that help and might, for example, reduce the need for staffing at night and enable economies of scope there in many respects. There are communication robots, which you may have seen in videos or seen in person, that go around and talk to the individuals, and some have impact on individuals with dementia, can lead exercise and so on, other types of robots. Those are the main kinds we focus on. There are specific care required levels as part of the long-term care insurance system in Japan, from the most basic type to the highest level of care required. That's according to the needing assistance with basic activities of daily living, such as eating, toileting, bathing, and so on. So these are standardized along with the long-term care insurance benefits in Japan, and then we're able to observe that and control for that when we're looking at nursing homes and whether they're adopting robots. So finally, before we get the data talk to you, reinforce this idea of the labor market for care workers is tight in Japan. What do we specifically mean by that? Well, there's a high demand for care workers from the increase in the proportion and the number of elderly in Japan. The supply of care workers is limited is not only because the working age population is declining. In fact, the total population in Japan has been declining, and the working age population is declining. But there's been a low unemployment rate. This occupation, despite the need, is relatively low wages and unattractive, given the back pain and other associated with it. And in addition, in Japan, there's been a particular reluctance to increase the number of immigrant workers in this field, although those restrictions have been relaxed more recently after the time period of our data. Some evidence on that is the ratio of job offers to applicants is about twice the average for other services and industries in Japan, and a shortfall of around 380,000 care workers predicted in the next 5 years. So this shows the proportion of 75 and older, and an increasing share among them of those 85 and older, which are most likely to require long-term care. In the same time, we show here the labor market for long-term care workers and how tight it is, illustrating that relatively low unemployment rate, and that the ratio of job offers to applicants in long-term care is about that twice of other industries. And here showing that projected deficit maybe of 380,000 care workers. So in light of this tight labor market in Japan, it may not be surprising to find that nursing homes adopt a more capital-intensive production process without many detrimental effects on labor, in contrast with which you might find elsewhere, like in US industry. But that's one of the things that we study. And so now I will turn it over to Yong to talk about our data and results.
Okay, thank you, Mark, for the introduction, and Karen for setting the stage. So what I'll do is I'll be, talking about the empirical analysis and the main findings, and I'll be sharing my slides. Okay, so hope everyone can see this well. So the data that we use to examine the impact of robots on staffing, wages, turnover, etc., is a survey of long-term care facilities in Japan. So they've been doing this survey, Japan has been doing this survey for several years, but only most recently have they included this question about robot adoption and related questions. So the survey itself is for a variety of long-term care facilities, about 8,000 in total, the sample is. But we're focusing on those specific facilities, the custodial care and the skilled care type, which is the typical type of nursing homes that we think about here in the US. Okay, and the survey has information not only on staffing and wages, but also robot adoption, but also other types of technology adoption, human resource management related questions and perceptions of robots, and many other questions as well. So that's our main set of data. The other important data that we compile ourselves is we hand collect these reports from each prefecture about the robot subsidy and gather information about the level of robot subsidies. There are several information, but the main information that we're going to use is the planned number of robots that each prefecture is planning to subsidize. But again, each prefecture is different, so we want to normalize that by the total number of nursing homes. So the main variable, we call it the instrumental variable, which I will be describing. But more in detail, the main subsidy variable we'll be using is the ratio of targeted number of robots to the number of nursing homes. Now, I just want to show you what the relationship looks like. So on the x-axis is the subsidy variable, planned number of robots per nursing home. And on the y-axis here is robot adoption at the prefecture level. And this is something we call a bin scatter plot. It's very similar to a scatter plot. And what it shows is that, yes, indeed, when there is a higher level of subsidy, robot adoption is higher in nursing homes. So these subsidies do have an effect on promoting robot adoption in nursing homes. So this is one thing I want everyone to have in mind. Next, what we'll see first examine present is, so there are a lot of data information in the paper. So if you are interested, we'll be happy to share the paper. Here we'll be just showing you some just key results. First of all, what does the robot adoption landscape look like? So Karen did mention this briefly. About 26% of nursing homes are adopting robots. That was 2017. We looked into the more recent information, and that's increased to about a third of all nursing homes. So robot adoption in nursing homes have been increasing gradually and steadily in nursing homes in Japan. But they are different. Nursing homes that adopt robots and those that do not adopt robots are naturally somewhat different. Robot adopters tend to be larger in terms of the number of staff. So here you can see that the staffing numbers are higher in total, both in caregivers and nurses. They tend to hire more foreign workers. And also, they do use other types of technology more so than non-adopters. For instance, you can think about robots, but there are these traditional technologies like adjustable beds. Most of them use these type of adjustable beds, wheelchair lifts, seat lifting wheelchairs, different types of lifts. So there is this level of technology adoption among nursing homes that adopt robots. In terms of age, they tend to be similar. Also, the share of residents requiring care level 4 or 5, Karen described it. So these are residents that require a bit more care, have more difficulty moving. These seem to be similar in general. So the ultimate thing is they are different. So what we want to do in our statistical econometric analysis is control for some key variables that might explain robot adoption when we're looking into the regression. Now, just a few more things about the landscape. So Karen didn't talk about this monitoring type of robot. So you might wonder, why is this a robot? Yes, it's technically not something what we would refer to as a robot, but it's an automation technology. It's not simply a monitor or a video. The key thing is that, for instance, one of the more challenging tasks of care workers in nursing home is to, at night, sometimes residents actually fall from the bed or may show abnormal behavior. What these monitors can do is actually detect abnormal behavior and then alert the care worker at the station. And when there's the alert, can go and check on the elderly and just make sure everything's okay, or if they're actually in need of some support. So these type of robots, automation technology has been most widely used and is aggressively promoted by the Japanese government as well. There's also information on perception in general. So people have some concerns about maintenance related to these robots, malfunction concern. Some believe that they might not be cost effective. They don't know much about these robots. And also, some people just believe that robots are not an appropriate form for care. It needs human interaction. So these are some information that's in the data, and what we've been observing is that these perceptions also change over time as they adopt more robots. So we can see can consider these as potential hurdles to adopting robots, but some of these are being relaxed as well. Okay, also one thing we find in terms of difference is that nursing homes that adopt robots tend to be located in more urban areas. And also number of care workers and nurses per residence are slightly higher in the rural compared to urban nursing homes on average. So there are some of these locational differences of the characteristics of nursing homes, and we also control for these in our statistical analysis. Now, this is the empirical model. So for those who are inclined, you can go through this slide carefully. For those who are less so, I'll be happy to just explain what the key aspects of this is. So basically what we're interested in is the staffing of nurses or care workers, the number of staffs basically. And whether robot adoption, how does robot adoption affect that number? Does it increase staffing or does it decrease staffing? Does it replace workers? That's the main question we ask. And as you can imagine, there's a host of other things that are related to robot adoption and staffing. So what we're trying to do in this framework is to try to control for as many of those observable characteristics that we can find in the data to better tease at this relationship. So for instance, we talked about the size of the nursing home, the location of the nursing home, the age of the nursing home, the management practices of the nursing home, the organizational corporation type, also the share of residents that require intensive care. So we try to control a host of those. That's the Z variables here. And then in addition, we also control for prefecture level variables, because you can imagine prefectures that are more aged, that have a higher share of 70 years or older, might have a differently affect robot adoption, right? And staffing as well, because the labor market conditions could be different. So we control for that, we control for unemployment, etc. So that's our main empirical model. We can examine as our outcome variable staffing, but also wages, also turnover. When we're examining wages, we can additionally control for worker characteristics because these information are in the data. Now, that's sort of the framework, but the main challenge still is that despite having these variety of control variables, there may be many other information that we don't know about that could affect both robot adoption and staffing. So that would actually bias, give an estimate that's not really the true impact of robot on staffing. These factors could be other management factors or the quality of the facility that we don't really know about, we can't observe. So the identification strategy that we employ to try to get at the causal effect of robot adoption on staffing is that subsidy variable that we talked about before. Remember that graph, we saw that prefecture level subsidy do indeed increase robot adoption in nursing homes. So the main idea is that we're assuming that that the subsidy affects robot adoption and only through that channel affects staffing or wages. It might not be a perfect assumption, but we believe it's a reasonable assumption that can potentially get us to closer to a causal estimate. Okay, so now I'm going to talk about some results. Okay, which nursing homes are more likely to adopt results? I'll just briefly show this in words rather than in tables. We talked about this. So size is an important predictor of robot adoption. There are management-related issues as well. So nursing homes that have a human resource manager or nursing homes that have HR policy, wage policy that says they seek to improve wages for retention, because often in cases in Japan or East Asian societies, they use a wage table rather than what we call performance pay here in the US. But those that have performance pay tend to adopt robot as well. So what this is saying is that management practices matter in terms of technology adoption. Now, in terms of prefecture, indeed what we find is the proportion of population age 70 or older is positively related with robot adoption. Prefectures that have an older demographics, they tend to use robots more intensively. what we find is unemployment rate is actually positively related to robot adoption as well. So higher unemployment is related to robot adoption. It might seem counterintuitive, but I think what we're gathering is that unemployment in general is pretty low in Japan. And what we think is what's driving staffing in nursing homes rather than local labor market condition, it's more of the demand for LTC workers, long-term care workers, and the supply conditions in that specific labor market. Okay, now I'll go over some results. So in this table, this is what we call the OLS result. So this is not the instrumental variable result that actually tries to get at the causal effect. This is more correlational. So you can think of this as this association, relationship between two variables. Here we're controlling for the host of variables, but ultimately what I want you to focus on is whether the confidence, whether the estimate is positive and whether it's statistically significant or not, which is represented by these stars, and I've highlighted in yellow. The key point here is you can see that it's positive. So nursing homes that adopt robots tend to have about 10% higher levels of staffing, especially regular employees. Now, what I want to bring in to discussion is there's two key types of workers that provide care in nursing homes. Those are the care workers and nurses. Care workers are workers who mostly do the custodial work, help them feed, bathe, go to the bathroom, less, what I call it's not directly related to treatment. Now, the nurses are the one provide care that's related to treatment, for instance, injections or a variety of treatment-related care. So you can imagine the nurses need to get nurse training, nursing school. They tend to have higher wages. Care workers, on the other hand, tend to be low-skilled and pays substantially lower, and turnover is actually quite high. So you hear about LTC workers in the US. I had previous research on long-term care. What we found in the US was that the wage of these care workers are quite low. It's comparable to working at a fast food restaurant. So you can imagine what turnover would be like. And there's a lot of physical strain involved in helping these residents, moving them around about. So what we're finding is, first of all, facilities that adopt robots, they tend to be larger, tend to hire more workers. This is just correlational. And the relationship is stronger for regular employees. And here, regular employees, we imply, we can think about full-time workers in the US who has full benefits and bonuses, who have a more steady employment contract. The non-regular employees do not have benefits, bonuses. What's important is their contract is much more weak, so they're more easily laid off compared to regular employees. And this distinction is a bit important in Japan. The US, firms can easily lay off people. In Japan or in Asian countries, it's a bit more stringent, and having these distinctions allow firms to become more flexible in their labor employment. Okay, so this is what we're finding. Now, one more association, a correlational result that I want to show before going to our causal effect is, okay, we wanted to examine, I'll first talk about adoption time here. So when we look into when they first adopted robots, what we find that firms, nursing homes that adopt robots more recently tend to have more workers, tend to be larger in some sense. And this is related to this discussion about robot vintages evolve over time, where recent robots might become more better and more expensive. And what we're finding is that facilities that adopt robots most recently tend to be larger. We're finding that communication robots seem to be more complementary to regular nursing staff, and aid robots were non-regular nursing staff. So this is just some association, correlational results here. But a lot of the main results are coming here among the nurses rather than the care workers. Okay. Next, what I'll start presenting is our causal estimates. Okay. The punchline here is we're not seeing many yellows, right? Not many stars. The punchline is, before we had associations between robots and staffing for sure, but none of the associations of robots with staffing for care workers or managers are statistically significant, other than for nurses and for non-regular employees. So what this estimate is saying, if a facility, nursing home adopts a robot, they tend to increase one additional non-regular nurse employees. So they're increasing staffing for nurses, skilled workers, but they're using, rather than the regular employment contract, a non-regular employment contract. They're preferring to use the more flexible employment contract when they're adopting robots. Okay, so that's what I want you to take away from the table. And there's evidence that wage tends to decrease, not statistically as strong as the staffing, but robot adoption may decrease nurse wage as well. Okay. Now, if we look into overall wage share, so this is basically thinking about the budget in the nursing home, and it's the share that goes to labor, basically wages. And what we're finding is that if a facility adopts robots, their wage share drops about by 15 percentage point, okay, 15.29. And this is intuitive in some sense because robots are costly, they become more capital intensive. But you can also think about, because they're actually moving towards a more non-regular, flexible wage structure, where wages tends to be lower, there's no bonuses and benefits. This could be also reflected in the reduction in wage share. Here, the causal estimate says, in terms of revenue growth compared to last year, did the firm become more profitable? We do see, so we don't know profit, but we have revenue information. It's positive, but it's statistically non-significant. So it's hard to tell exactly if they're becoming more productive. But in general, in the literature, we do believe that there will be some time lag in terms of the benefits of these new technologies in these facilities as they better learn how to efficiently use technology. In terms of turnover, overall, this is our causal estimate. We're not really finding significant effects, but there is a hint of evidence that says that, okay, robot adoption may be increasing turnover, especially for the regular workers of nurses as well. This is for care workers. Okay. So, so those are the key results, and I want to reserve some time. So I'll go over some conclusion and implication and briefly talk about where we're heading with this research agenda, then open up for discussion. Overall, there's little evidence of the effect of robots or automation in the service sector as of now. Most of the research has been in manufacturing, the industrial sector. So we were one of the first studies that examined the impact of robots in the service sector, specifically the healthcare nursing home sector in Japan, where aging has been high, and where robot adoption has been actually increasing rapidly compared to most other countries. When we're analyzing 2017 data, still we're at a relatively early stage of diffusion, we find that facilities that adopt robots are larger, they have more functionally impaired residents, care workers and nurses, also other technologies, also better than practices. What's also important for us is that prefectures that have higher planned robot subsidies actually have higher levels of robot adoption. And we use this information, and one thing to take away is that what we're finding is that, yes, it actually does, so we don't find a substitution of it. It's not replacing workers, it's actually increasing the skilled caregivers, the nurses, but of the more flexible employment type, and there may be increases in turnover as well. And relatedly, we see this decrease in wage share. So the results might differ from the literature in various aspects, but I think what we want to take away is that the effect of robots, automation, such as AI or robotics, will differ across societies and industries. And we want to take that into account. Japan is unique in terms of its aging society, but others will follow, but has a very tight LTC market, long-term care market. But the long-term care market in general is always a bit challenging here in the US as well. So what I think we want to do is we want to examine this over a longer time horizon to get a better sense of how this might be evolving over time, and whether the effects of automation may change and firms may need to adopt and in a few years, the effect might differ in terms of replacement of labor or productivity. So I just want to finish off with where we're heading with this research agenda. So there is a 2018 survey. We've been looking into this gradually, and want to continue examining this with this same set of survey data. But the survey data is limited, and Karen sort of alluded to our overall research project that something that's important is the quality of care. Ultimately, we want to examine how adoption robot technology affects the patients. And there's no survey on that. So what we're doing is we actually conducted this survey early this year, and we recently just got the data. We asked about how the patients, the residents are doing in terms of dementia, in terms of falling, in terms of pressure ulcers, etc. So that's the focus we'll be having, as well as the more detailed information on management practices. So that's where we're heading with this. And another research agenda, also, which Karen alluded to, is we all know that nursing home have been disproportionately suffered from COVID-19, and this will likely actually affect how technology is adopted in the future. So we plan to examine technology adoption at post-COVID-19 in the US as well, and other Japan and other countries by conducting future surveys. So I'll wrap up my presentation here and then head the screen back to Mark.
Great, thanks to both Karen and Yong for that really interesting presentation. As someone who studies the healthcare sector, I found it especially interesting. We have a bunch of questions from the quote audience that I'll get to shortly, but I just have a couple of questions before turning to their questions. So first, you alluded a little bit to this idea that there may be differences in the effects in the short and long run of these robots. So it may be the case that the technology, as it's, nursing homes are figuring out how to use it, and as the quality maybe of the robots is getting better, maybe it will change over time. So I wonder to what extent you think that is likely to be an issue for interpreting the results.
Yong, do you want to?
Yeah, sure. I'll give a first stab. So I've sort of examined this actually in the industrial robot sector in the US. So there's a well-known paper that shows that robot adoption in manufacturing reduced employment in the US. But once we examine this in more recent years, I'm actually finding complementary effects that firms, locations that adopt robots actually increase employment in the manufacturing sector. And also some colleagues that I know in Japan have examined this as well, and industrial robots have been nowadays are increasing labor, employment, jobs. So initially it might seem that these robots displace workers, but ultimately as firms adopt, new vintages come, it could change that pattern. And we believe that this is the case in Japan. It's a bit hard to tell where Japan is at this stage with robot adoption in nursing homes. But we do expect that currently they're close to a 30% level, and they've adopted robots for a while now. So we believe that it could change, but I think ultimately what's important is that the labor market condition is quite unique. So unless, and when there's always a shortage of labor, robots may not necessarily substitute workers, but be used and allow workers to perform other tasks that they weren't able to do before, provide better care maybe.
Yeah, just maybe to add to that, I mean, we know there's a debate about whether robots are going to complement or substitute for workers. It might be more specific tasks that they're related to. And we know if the technology is evolving, some of the early adoption might not be the most appropriate forms of robots, as you were saying, Mark. And also they're being subsidized directly. So that might lead homes to adopt earlier than they might otherwise. So actually one of the questions that we asked in our own survey fielded early this year was, whether you have robots and whether you're using them, right? So they vary we just look at whether they adopt or not, how often they're used, and then the impact on that on the caregivers and the clients is another aspect that we hope to look at. We certainly think that it'll be changing over time. We saw a difference between the 2016 and 2017 data, and we'll have the 2018 data for this that we're looking at, as well as our own data. Be able to know more about that soon, hopefully.
Great. All right. Thanks to both of you for that answer. Another question I have, if you look at the nursing home market in the US, the vast majority of nursing homes are organized as for-profit firms. And then most of the rest are private nonprofits. And so I'm wondering, is it the case in Japan that nursing homes tend to be owned by the government in contrast to the US? Or are they nonprofits? And if so, whatever the answer is, do you think that the nursing home's ownership type could be influencing its adoption decisions?
Well, they could be, and we do control for that. The vast majority are what I guess we call private, not-for-profit. Around 80% are run by social organizations. And actually,
Okay.
There's a restriction on for-profit in healthcare as well as long-term care in Japan. There are some that are government-owned, but that's a small share, like only around 2% of the ones that we study, different size structure. Some run by medical organizations and so on, but most, you could think of these as equivalent to private nonprofit organizations.
Okay, so that's different. That's a pretty big difference from the US. And then finally, before I turn to the audience questions, another question that I have is whether, so this is robots that are being used in the nursing home. Do you have a sense whether robots could be used in people's homes to help keep them out of nursing homes? So to help them, do you know what I mean? So that, because it's expensive for people to be in nursing homes. And so I wonder if you've heard anything on that front.
Yong,
yeah, so it's a great question. So we don't actually, it's something that we're looking into right now. We don't have great data on this, but it's something that we plan to actually examine. And I believe some people at Stanford are interested in examining these issues as well. Yeah, so that's a great point, and it's on our radar, and hope to address that issue going forward.
Great. Okay. Question from one of the questions from our audience has to do with how are the subsidies established politically? Are there lobbies for these? And is that is it sort of similar to the political process in the US that influences how subsidies are set?
Well, that's a very interesting question. We've talked about looking into the political economy of it, and if our colleague Toshi Izuka were here, he could talk more about it. We don't have a lot of great information right now about how that works, although we know there's variation. Even within prefectures, certain cities will be adopting, and we've actually started collecting data about where the manufacturers are located to see if it's related, but we don't actually have definitive information about that. Yong, I don't know if you want to add.
No, I think that's correct. So we don't have definitive information. They tend to be similar in terms of the amount that they're willing to subsidize. But I think this is the variable that we found most variation is this number of robots that they're actually planning to provide, and the variation in nursing homes in prefectures, and that's the one that we're primarily using.
Okay, great. Another question that I think is quite interesting is whether they might be relabeling things that aren't really robots to be robots to qualify for the subsidies. So for example, this person mentioned ultraviolet light push carts as not really robots. Do you have a sense of that?
So I think they do, the Ministry of Health and Labor and as METI, I think they have very strict definitions of what robots in long-term care are. And the delineation of, it's not our arbitrary delineation that there's this mobility robots that are wearable and non-wearable. So it's actually set by the government, and they sort of categorize this. So I think that concern is a bit mitigated. But obviously one can't rule that out perfectly.
Right. Okay, the next question has to do with the financials on the robots. What is the average price of a robot? and how long do they think that the typical robot will last?
Should I go? Okay, so some of the information we have is initially they were subsidizing about 100,000 yen per robot. That translates to about $1,000, and that we believe that was the general price. That was the initial years, but more recently it's about 3,000. So about on average it's $3,000. But you can see that there are a variation of the types of robots. So this is more on average price. In terms of how long they last, frankly, I don't have information on that. But what we're finding is that their concern for malfunctioning has been decreasing a bit.
Great. Okay. And do you have a sense as to, maybe it was hard to tell from the survey, but how people in the nursing homes feel about the presence of the robots? Are they, in general, does it raise morale among the workers, or, and for that matter, the patients? Like, do the patients bond with the robots?
Well, we don't have a lot of information on that from the survey, although there's suggestive evidence. I mean, Japan has run a pilot study, and I think about a couple dozen nursing homes where they asked detailed questions of care workers and clients, and find some mixed evidence. Obviously, that changes over time as there's a sort of a comfort level, and particularly with the staff also figuring out that they're not here to replace you, but to augment what you do and figure out. As we know more broadly for technologies, there's often sort of a re-engineering process where the whole structure of the firm has to figure out how these technologies complement or substitute for what tasks and so on. There was some evidence that clients were that some were happier to use robots, and there has been a decrease in those. As Yong mentioned, there's questions about perception of use of robots, and we see those reporting that robots are inappropriate for long-term care has gone down. Actually, Japan had set the goal of having people reporting appropriate use of robots to be 80% among both clients and care workers. And what we find from the survey is they've reached that. It's like 82%.
Wow, okay, that's terrific.
Yeah. Just to add, in terms of just the residents actually find, so this is more anecdotal evidence, and it's probably showcased in New York Times as well in the US. They find these communication robots most comforting, less intrusive. So you saw those seals or other or small animal type where people, especially dementia patients, envision the person they're talking to in that robots, and that often has comforting effects and seems to be received well by the residents.
Okay, great. Another question is, have you seen any concerns by nurses and facility staff with respect to their privacy when working with robots that have sensors like cameras and microphones and so forth?
That probably is an issue. We don't have specific information on that from the survey, but there are many things about comfort level of working with robots that might allude to that kind of factor. It seems to be higher in Japan than many other places, sort of the comfort level of working with these technologies, but obviously it varies. And one of the ways in which they may need to re-engineer processing within nursing homes is to respond to those kinds of concerns.
Okay, great. And then another question that we have is, have you actually seen any actual transfer robot deployed? The photo that you showed is the only photo around, but it's not a real robot that is functional or deployed, claims this question. I don't know, yeah.
Well, yeah, we have seen, as we reported, the monitoring robots, and then there's some communication, we lump them together, are most common, but transfer aid robots are reported to be used in these nursing homes, is actually the second most common category. Those are not all, as the person said, the part that's not worn is not as common, but there are many that are actually worn by the caregiver. So, but they have been seen, and they have been spotted.
Okay. Great, great. And it's sort of related to a question that I had earlier. How would the effects be affected if the robots are implemented as living assistants in own homes rather than in a part of staffing in nursing homes? So do you have a sense for that?
Yong, do you have anything specific?
Well, it's hard to tell, but I guess one of the things as we've experienced right now is there is this concern of going to facilities with high density of residents together. If that technology becomes available, I think a lot of potential residents will opt in for that. One thing I think will be cost effectiveness. These robots are not cheap, especially if one is to actually purchase it at the household level. So I think that will be the hurdle, but potentially I think it is a direction that some of the innovation might actually happen.
And I might just add that Japan and some other places in Asia, unlike the US and Europe, or to a greater extent, will often have the elderly individual stay at home at night and then go to a daycare facility when they're at work during the day. And so there might be an additional comfort level there of having the same technologies in both places, or being able to have them talk to each other, that wouldn't speak to the adoption process there in Japan. We hope to look into it. This data does include in-home services a little bit. And some facilities that we study, we look at the residential facilities, but some have daycare services as well as residential facilities in the same structure.
Okay, great. And let me see, I have another question here. How are you thinking of assessing the quality of care, especially with respect to the use of communication robots?
Well, it can be difficult to measure quality of care, as you know, Mark, from looking at
Yeah.
healthcare, but also in long-term care. There are some standard things about falls and use of restraints, which is illegal in Japan, but and other things about functional status, but then you have to carefully risk adjust and so on. So that literature is not as well developed for Japan, and we have collected some in our own survey of measures. Some just use a staffing level, say nurse per resident as a proxy for looking at quality. And there's some other measures that we're going to use, although it'll be imperfect and we can't get to the fine grained level that the question might have asked about. Yong, do you want to add?
Yeah, so one thing, especially about the communication robots, we've been thinking about that issue quite a bit, because that is the most prominent mode of robots, and the effects could be in depression, because these residents often suffer from depression. And what we wanted to see is whether that can actually reduce the incidences report depression levels in nursing homes. So I believe we've added that question. Can't remember exactly, but depression and dementia would be the measures. With dementia a little bit more challenging, but depression would be one measure that we would use.
Okay, great. And then there's a question about whether you have, do you have data on the emotional labor aspect of care and how that is affected by the robots?
We wish we did. In the future, we will more. This survey doesn't really ask about that. I mean, Yong can speak to that, although they do ask many questions, that's not among them. And it's cross-sectional, so we can't do a panel at the individual. We have the wage, but not emotional aspects of care. There has been some anecdotal evidence we talked about in our survey. We asked some specific, but so far that's mostly at the facility level rather than individual caregivers about their aspects. So it's an important area to look at in the future. We don't have good data yet on that.
Great. Okay. Well, I'm sorry I didn't get to all of the questions, but just one question that's come up from a number of people is, this is really interesting work. How do they get a copy of the paper or the slides? So in any case, do either of you, is the paper yet ready for on your website?
Yeah, we'll be happy to share a draft and get people's feedbacks. It's very preliminary. We have our own survey and the new 2018 data we're planning to include. So we value your feedback as we continue to revise the paper. And I can send a copy to you, Mark, or you can share that copy and we can share our version as well.
Yeah.
We haven't yet posted it, Yong, but go ahead.
Yeah, and I could post it on my website, so one can access that. We'll share the slide with Celia, so maybe she can post it on CEPR or HAI's website as well.
Yeah, and we do plan to post it as an MBR working paper in the next round of revision.
Okay, so it should be ready soon.
Yeah.
Well, with that, I see that we are at 5 o'clock, and I was told that I have to end on time. So even though I'd love to ask more questions, thank you again, both Karen and Yong, for a fascinating presentation on this really important topic. And yeah, and thanks again, everyone, for joining us.
Thank you.
Thank you very much.